Ask most people what kidney trouble feels like, and they will tell you back pain, or that you would surely notice something when you went to the bathroom. Almost none of that is true, and that is exactly why kidney disease is the quietest serious illness in this country. More than 1 in 7 American adults have chronic kidney disease right now, about 35.5 million people, and that number is from the CDC. Among adults over 65, it is 1 in 3, and as many as 9 out of 10 of them do not know they have it. Not because they are careless, because their kidneys never told them. Kidneys do not have pain nerves the way your back does. They lose ground quietly for years. By the time we are allowed to call it kidney failure, according to the National Kidney Foundation, 85 to 90% of the function is already gone. Your doctor is not hiding this from you either. In a 12-minute appointment, there is time to check your blood pressure and refill what needs refilling. There is no billing code for taking somebody's hand, turning it over, and studying their fingernails under a good light for 10 minutes. So almost nobody does it. But your body has been keeping a record anyway, in a place you look at 40 times a day and never actually see. I'm Dr. John Myers, and I am going to show you 9 things your fingernails do when your kidneys are in trouble. Before you click away because you assume this is about yellow nails and fungus, none of the 9 is an infection. Not one. Every one of them gets written into the nail by your blood. So look at your hands while I talk. A pair of white bands that vanish when you press on the nail and come straight back when you let go. A shine on the nail that comes from something you have been doing in your sleep for months without knowing you were doing it. That is number 5, the sneakiest thing on this list, because it is the only sign here that makes your nails look better. And at the end, number 9, a nail split into 2 colors with a hard line across the middle, which turns up in up to 40% of people with chronic kidney disease and almost never in people without it. One honest thing first, because a lot of what gets said about this online is backwards. Your fingernails are not an early warning system. Some of these show up when kidney disease is already well along. The blood test is the early warning. Your nails are simply the part you can see for yourself, tonight, with no appointment and nobody's permission. They are the reason you finally go and get one. And that matters, because kidney disease caught early is something you live alongside for the rest of a long life. Caught late, it is a machine, 3 days a week, 4 hours at a time. Kidneys are one of the systems that change the most after 60, and they are the one people understand the least. So I took everything I tell my own patients, and I put it into one simple plan for living longer, stronger, and healthier after 60. 28 of the things that actually change as you get older. Your blood pressure, your blood sugar, your memory, your balance, and those are only some of them. Your kidneys are in there too. What is really happening inside you and the one simple thing you do about it for every single one. Thousands of people are already using it to take back their health. Every one of them started right where you are with something on their mind that nobody ever had the time to sit down and explain. The difference is they stopped waiting to find out how it ends. It is on your screen right now, and it is drjohnmyers.com. All right, look at your hand, one idea first, and everything hangs off it. Your fingernail is built by living tissue, out of your blood. Under the fold of skin at the base of your nail sits a patch of dividing cells called the matrix. That is the factory, fed by some of the smallest blood vessels you own. Every day it takes whatever is dissolved in your blood, the protein, the oxygen, the minerals, the waste, builds the next thin slice of nail out of it, and pushes that slice forward. A fingernail grows about 3 millimeters a month. So the nail you are looking at, cuticle to tip, is roughly 6 months of your blood chemistry, laid down in order, oldest at the fingertip. Your nails are a 6-month printout of your blood, and you are holding 10 of them, now. When kidneys fail, they change exactly 4 things in that blood. 4. Keep count, because all 9 signs come out of one of these. 1. Protein leaks out of you. Each kidney holds roughly 1 million tiny filters called glomeruli, the little knots of blood vessels that do the straining. Their mesh lets water and waste through while holding protein back. Damage the filters and that mesh goes sloppy. The first protein out the door is albumin, whose job is holding fluid inside your vessels. So albumin goes down the drain and the level in your blood falls. 2. Your blood goes thin. Your kidneys tell your bone marrow how many red blood cells to make, using a hormone called erythropoietin. Sick kidneys make less of it. Fewer red cells is anemia, and anemia means less color in the blood feeding every tissue in your hand. 3. Waste builds up. Urea, creatinine, a long list of compounds we call uremic toxins. All of them were supposed to leave in your urine. Instead, they stay in circulation and irritate every surface they touch, including your skin, including the bed of your nail. 4. Growth stalls. Under that kind of long, grinding strain, the body pauses the construction projects it considers optional, and there is very little it considers more optional than a fingernail. Protein down, blood thin, waste up, growth stalled. Those 4 are the pen. Your nail is the paper. Let's read it. Number 1. Pale nail beds. That is the anemia, our second. The pink you see in a nail is not the nail. The plate is a translucent yellowish sheet, and that color is blood showing through from underneath. So, a 5-second test. Press firmly on your index fingernail with your other thumb and hold 3 seconds. The bed blanches as you squeeze the blood out. Let go and watch. In a healthy adult, the color floods back in under 2 seconds. If it comes back slowly, or the pink it comes back to is washed out, watery, almost gray, that is fewer red cells arriving. Anemia has 100 causes, and most are not your kidneys. But it is one of the most common complications of chronic kidney disease there is, and it is why so many people with early kidney trouble come in complaining about something else entirely. They are tired all the time. Stairs leave them short of breath. They feel cold when nobody else is cold. And they file all of it under getting older. It is a hemoglobin level, and that is a $2 blood test. Number 2, brittle nails. Splitting, peeling, ridges running up and down. That is the protein, our first. And I am going to be honest with you right now, because I would rather you trust the other 8. Sincere, this is the weakest sign on the list. Brittle, ridged nails are extremely common and usually have nothing to do with your kidneys. Dish soap does it. Cold weather, a low thyroid, and simply being 68 years old all do it. A study out of Brazil compared the nails of dialysis patients against healthy people the same age. 86% of the dialysis patients had at least one nail abnormality. So did 75% of the healthy ones, and the ridges running up and down were actually a little more common in the healthy group. Ridges are aging. It earns its place only because the nail plate is keratin, and keratin is protein and nothing else. When albumin is escaping into your urine day after day, the nail comes out thin and poorly bonded. So make it count. Ask whether it is new. Not are my nails brittle, but are they more brittle this year than 2 years ago when I have not changed a thing? A change is a signal. A lifelong state is not, and ask whether it is stacked with anything else here, because that is the game from now on. 1 sign is noise, 2 or 3 together is a pattern. Number 3, Bowes lines, growth stall, our 4th, and this one has something built into it that I love. A Bowes line is a groove running sideways across the nail, edge to edge. You can usually feel it before you see it, so run the pad of your other index finger slowly down the nail. It feels like a small step down and then back up. It means the factory stopped. For days or weeks, the matrix came under so much stress that it quit laying nail down properly, so the slice built in that window came out thinner than the nail on either side. Then the crisis passed, and the matrix went back to work, pushing that dent forward ever since. And a groove is not a kidney sign on its own. A bad illness will do it. A high fever, chemotherapy, uremia does it too. So the groove does not tell you what happened. It tells you that something did. And here is the part one love. You can date it. The nail grows 3 millimeters a month. 3 millimeters out from the cuticle is about a month ago. Halfway up the nail is 2 to 3 months. Out near the tip is 4 to 6 months back. So find the groove, measure it, and go look at your calendar. Either you can name the event, the flu, the surgery, the week you could not get out of bed, and the mystery is solved. Or you cannot name anything at all, and a body that stopped building fingernails for 2 weeks over an event you have no memory of went through something without telling you. Number 4, Muirche's lines, back to protein. And this is where the list stops being suggestive and gets specific. They are a pair of white bands running sideways across the nail, 2 of them, parallel, usually with a stripe of normal pink in between, usually on several fingers at once, and classically skipping the thumb. Everybody has seen a white mark on a nail, and most are nothing, just trapped air from a knock you have forgotten. So here is how you tell the difference, and it is the best 60-second test in this whole video. Press down on the nail and squeeze the blood out of the bed the way sign 1. If the white bands disappear while you are pressing and come straight back the moment you release, those are Muirche's lines. Sit with that, because it is genuinely strange. A mark that vanishes when you push on it cannot be sitting in the nail. Those bands live in the nail bed, in the tissue and small vessels under the plate, and you are looking straight through the nail at them, which has a consequence. You can check yourself. They do not grow out. Trim your nails, wait, come back, and the bands will be in exactly the same place. What causes them is low albumin, not a little low, very low. Robert Murky published the original series in the British Medical Journal in 1956. 32 patients with these paired bands, and 23 of them had nephrotic syndrome, which is kidney filters gone from leaky to wide open. The bands only appeared once blood albumin fell below about 2.2 grams per deciliter. Normal is around 4. And look at what walks in alongside them. Ankles that puff up by evening, puffiness around the eyes in the morning, one of the earliest visible signs there is, and one almost nobody connects to their kidneys. And foam in the toilet bowl that does not clear when you flush, because protein in urine foams. So if you press your nail tonight and a white band disappears under your thumb, that is a phone call. Now, number 5. This is the one I most want you to see, and it will feel personal to a lot of you because it does not look like a problem at all. It looks like good grooming. One quick thing first. If this has been useful, subscribe, hit the like button, and do me a favor in the comments. Tell me how old you are. That genuinely decides which topics I do next. Alright, number 5. Shiny nails. Glossy, buffed, polished looking, with no polish on them. That is the waist, our third, and it is sneaky for 2 reasons. The first is that nobody in the history of medicine has ever taken shiny nails to a doctor. Every other sign here looks like a problem. This one looks like a compliment. The second is the mechanism, because the nail is not doing this. You are. When kidneys fall behind, uremic toxins build up in the blood, deposit in the skin, and set off one of the most miserable symptoms in medicine. Doctors call it uremic pruritus. Everybody else calls it an itch that will not stop. And it is a very particular itch. There is usually no rash to show for it, which is exactly why people get waved off. It is worse at night. It turns up on the back, the arms, the legs, places with nothing in common. Moisturizer does nothing. Antihistamines do nothing, because there is no histamine driving it. And this is no footnote. In the largest ongoing study of dialysis patients in the world, about 2/3 report itching, and around 4 in 10 are at least moderately bothered by it. 4 in 10. So people scratch, every night half asleep, for months. And they scratch with the edge of the fingernail. A fingernail is fairly soft. Months of dragging it across skin, thousands of times, wears the surface down and buffs it to a shine. The free edge gets worn smooth and rounded without you ever picking up a file. Dermatologists have a name for it. They call it shiny nails or polished nails, and it is a recognized physical sign of long-term scratching. The shine is the fingerprint the itch left behind, and the itch is the kidney sign. So take your hand to the light and look at the surface of the nail rather than the color. Is it glossier than it used to be? Is the free edge worn smooth when you have not touched it with a file? Then answer the harder question honestly. Have you been itching? Not the occasional itch, a months-long itch, nothing to see on the skin, worse the moment you get into bed, that no cream has ever touched. A lot of people who have exactly that have already filed it under dry skin, or winter, or age. An itch with no rash at 68 is one of the classic ways advanced kidney disease announces itself. Nobody dies of an itch. But an itch ignored for 8 months is 8 months you did not spend protecting the kidney. Number 6. The vanishing half moon. Look at the base of your thumbnail. There is usually a pale whitish crescent just above the cuticle. That is your lunula, the only piece of the nail factory you can actually see, the front edge of the matrix showing through. Growth stall again, and this one has better evidence than people realize. In that same Brazilian study, a missing lunula was one of only 3 findings that genuinely separated the dialysis patients from the healthy group, turning up in between half and 2/3 of them. The other 2 are also on this list, and one of them is number 9. One honest caveat, because I am not going to have you panicking over a thumbnail. Plenty of healthy people never had a visible half moon on their little finger, and a lunula can be hidden by nothing worse than an overgrown cuticle. The version that counts is the one where it used to be there and now it is gone. Number 7. Spoon nails. Look at your nail edge on, at eye level, sighting along the finger. A normal nail has a gentle dome. Coilentia is the name for what happens when that curve turns inside out. The nail flattens, then dips, so the center sits lower than the edges, and the whole nail becomes a shallow bowl. There is a test for it that has been in the textbooks for 100 years, and it works. Put a single drop of water on the flat of the nail. On a normal nail, it beads and rolls off. On a spoon nail, it sits in the dip and stays. Now I want to be careful, because this one gets overstated everywhere. A spoon nail is not a kidney sign. It is the classic sign of iron deficiency anemia, and hold on to that word iron, because it is the whole reason it made the list. Iron deficiency is very common in chronic kidney disease. Failing kidneys absorb iron poorly, and the inflammation that travels with kidney disease locks iron away where the bone marrow cannot get at it. So a spoon nail says get your iron checked, and then find out why it is low, because why is the part everybody skips. Iron deficiency in a woman of 30 is a period. In a man or a woman of 68, it is a question, with 2 serious answers that must be ruled out. Something is bleeding slowly in your gut, or a kidney has stopped keeping up. Number 8. Splinter hemorrhages. Thin, dark red or brown lines running lengthwise up the nail, usually a few millimeters long. They look exactly like a tiny splinter of wood trapped under there, which is where the name comes from. They are burst capillaries in the nail bed. Waste again are third, along with the vessel fragility of long-standing kidney disease. In that dialysis study, splinter hemorrhages were the third of the 3 findings that separated patients from healthy people. But this sign has the most dangerous lookalikes on the list, so I have to draw 2 hard lines. The first, most splinter hemorrhages are trauma, and that is the honest truth. You caught your finger in a car door, you have been gardening. If it is one nail on the hand you use, and you can think of a knock, then a knock is almost certainly what it was. The second is urgent, and I need you to hear it. Splinter hemorrhages appearing across several nails at once, in somebody who also has a fever, or night sweats, or who feels unwell in a way they cannot explain, can mean infective endocarditis. That is an infection growing on a heart valve, throwing tiny clots out into the body. Kidneys have nothing to do with it. That is today. That is being seen, not booked. And one more line, which has nothing to do with kidneys but belongs here. A single dark brown or black band running the length of one nail, especially if it is getting wider or the color is bleeding out into the skin around the cuticle, can be a melanoma growing under the nail. It is exactly the kind of thing that gets dismissed as an old bruise for 2 years running. The one to act on is new, single, widening, changing. That is a dermatologist, and soon. All right, number 9, half and half nails. This is the one. If you take a single thing away from today, take this. Half and half nails, also called Lindsay's nails, after the physician who described them in the 1960s. The bottom half of the nail, nearest your cuticle, goes a dull, flat, frosted white, chalky, like ground glass, and you cannot see the pink through it at all. The top half, nearest your fingertip, turns reddish-brown, darker than a normal nail bed has any business being. And between the two there is a sharp horizontal line, right around the middle, no gradual fade, a line. 3 things set this apart. The first is that it does not grow out. Trim the nail, come back in 3 months, and the line will still be sitting halfway up, because just like Mirka's lines, this is not happening in the nail plate. The nail bed underneath has changed, and you are seeing it through a clear window. The second is what makes each half, and this is where the whole video ties together. The white bottom is swelling and fluid in the tissue of the nail bed, hiding the pink. The brown top is pigment. Uremic toxins circulating in the blood appear to drive the pigment cells in the nail bed to lay down extra melanin, so 2 of our 4 are written into one single nail at the same time. The protein failure made the white half, the waste made the brown half. Your kidney wrote both ends of that nail. And the third thing matters most. Pale nails have 100 causes. Brittle nails have 100 causes. Half and half nails turn up in as many as 40% of people with chronic kidney disease and are distinctly uncommon in people who do not have it. It is not proof, but of everything I have shown you, this is the one a good doctor stops and looks twice at. So tonight, take your hand under a real lamp and look at your thumbnails. If you see a white bottom, a brown top, and a hard line across the middle, do not panic, because panic has never once fixed a kidney. But do not let it sit either. That is a phone call in the morning. Now, everything I have shown you is a hint, and not one of the 9 is a diagnosis. So let's turn the hint into an answer. There are 2 numbers, and you ask for them by name. The first is your eGFR, estimated glomerular filtration rate. It comes off a standard blood test, calculated from a waste product called creatinine, and it estimates what percentage of normal filtering your kidneys are still managing. Above 90 is normal. Below 60, if it stays there 3 months, that is chronic kidney disease, and the number gives you the stage. Below 15 is where the dialysis conversation starts. Most people over 60 have had this test already, and nobody ever read it out to them. The second is the one almost nobody asks for, and it is the one that catches this early: the urine albumin to creatinine ratio. The letters are UACR. You pee in a cup, and the lab measures whether albumin, the protein we have been talking about this whole video, is leaking into your urine. Understand the difference, because this is the whole ballgame. Your eGFR tells you how much kidney you have left. Your UACR tells you whether you are still losing it. Albumin can be leaking into your urine while your blood test still looks perfectly normal because a kidney under attack compensates. The surviving filters work harder and hold that number up right until they cannot anymore. The National Kidney Foundation is blunt about it. Both tests are needed. So ask for both and say the urine one out loud because you will very likely have to. 2 things protect the kidney you still have. Blood pressure, because every beat of your heart drives blood through those million filters, and pressure that runs too high grinds them down. And blood sugar, because diabetes is the leading cause of kidney failure in this country, and high blood pressure is the second. But the one to do something about tonight is in your cabinet. Ibuprofen, naproxen, the whole family of anti-inflammatory pills you can buy without asking anyone's permission. Now and then, for a headache, they are fine. Taken every day, for years, at 68, with blood pressure on top, they cut the blood flow through the kidney, and the National Kidney Foundation names people over 55 with high blood pressure as exactly the group at risk. A bad knee is one of the most common reasons a kidney ends up where it is. I am not telling you to stop a medicine your doctor prescribed. I am telling you to take the bottle you bought yourself, be honest about how often you reach for it, and have that conversation this month. So, the 9, fast. 1, pale nail beds. Press, release, count. 2, brittle and ridged nails, the weakest sign here, and I told you so. 3, Bow's lines, the groove running sideways that you can date. 4, Mirka's lines, the 2 white bands that vanish under your thumb and never grow out. 5, the sneaky one, shiny buff nails, which are months of scratching an itch that has no rash. 6, the half moon that used to be there and is gone. 7, spoon nails, the water drop test, which is iron. 8, splinter hemorrhages, usually a knock, but several nails plus a fever is an emergency. And 9, half and half nails, white bottom, brown top, a hard line across the middle. That is the one that speaks loudest. 1 sign is noise. 2 or 3 together is a pattern, and a pattern is worth exactly 2 lab tests, an eGFR and a UACR, and about 15 minutes of somebody's time. Kidney disease does not hurt, and it does not announce itself. 9 out of 10 of the people who have it are walking around today with no idea, and the body has been leaving the evidence out in the open the whole time, on the ends of 10 fingers, where anybody who knows what to look for can read it. Now you know what to look for. If this was useful, subscribe, hit like, and leave me a comment. I do read them. Go and look at your hands under a real light tonight. 10 fingers, 1 lamp, 2 minutes. I'm Dr. John Myers. Take care of yourself.